basic introductions. We may do quick opening statements, and then we're truly interested in hearing, and then we'd really like some dialogue of some of the nature of the questions. All right, I'd like to introduce our four distinguished witnesses. Dr. Julie, I'm going to get it right, Topolsky. Did I get close? All right, we'll practice on that. Is the Congressional Budget Office Directors of Labor, Income Security, and Long-Term Analysis, and directs the annual publication of CBO's Demographic Outlook, which is actually, last year's is on my table in my office. Before that, she led the long-term analysis on which is responsible for the long-term projections on Social Security, Medicare, Medicaid, and the federal budget, as well as long-term analysis of policy changes in those areas. She received her PhD in economics from the University of Maryland. Thank you for joining us. Mr. John Scott is the director of Pew Retirement Savings Project. His research focus is on retirement policy and aging issues, including Social Security retirement savings plans. Before joining Pew, Dr. Scott taught and conducted research in public policy at the University of North Carolina at Chapel Hill, with a focus on issues related to aging, tax policy, and the policy-making process. Where are you when we need you? Mr. Scott received his master's in sociology from the University of Maryland and his law degree from Pennsylvania State University. Dr. Ben Harris is vice president and director of the Economic Studies program and director of the Retirement Security Project at the Brookings Institute. He most recently received his Assistant Secretary of Economic Policy and Chief Economist at the U.S. Treasury Department. Could you make the title any shorter? Prior to joining Treasury, Dr. Harris was the Executive Director of the Kellogg Public-Private Initiative and a Research Associate Professor at Northwestern University. Dr. Harris has held several senior positions in government, including Chief Economist and Economic Advisor to then Vice President Joe Biden, Senior Economist with the White House Council on Economic Advisors, and Senior Economist at the U.S. Budget Committee. His primary area of research focuses on fiscal policy and retirement policy. Dr. Kathleen Ann Edwards is a PhD economics and independent economics policy consultant. She is also an adjunct economist at the RAND Corporation and a lecturer at the University of Maryland School of Public Policy. Dr. Edwards previously served as an economist and associate economist at the RAND Corporation and as a research assistant at the Economic Policy Institute. I think we're repeating ourselves. Her research focus is on the intersection of labor markets and public policy, including unemployment and underemployment, unemployment insurance, women's labor issues after children, poverty, and Social Security. Doctor, can we begin with your 5 minutes?
Chairman Heinrich, Vice Chairman Schweikert. Is that better? Yes, okay. I'll start over. Chairman Heinrich, Vice Chairman Schweikert, and members of the committee. I appreciate the opportunity to appear before you today. I'll discuss the Congressional Budget Office's preliminary demographic projections for the United States, which will be finalized in January. I'd like to make 4 main points. First, our population projections drive our budget and economic projections. For example, the number of people who are employed and paying taxes on their wages depends on the size of the working age population. That population, the number of people ages 20 to 64, grows more slowly in our projections than the number of people age 65 or older. The number of beneficiaries of Social Security and Medicare depends on the size of that older population. Second, the population of 342 million in 2024 grows by 46 million over the next 30 years in our projections. Population growth is determined by births, deaths, and net immigration. Over the next decade, immigration accounts for about 70% of the overall increase in the size of the population. The greater number of births and deaths accounts for the remaining 30%. Digging in on that a little bit, the total fertility rate for women ages 14 to 49 is around 1.7 in our projections. That's below the rate of 2.1 births per woman needed for the population to replace itself, and lower than it has been historically. Also in our projections, mortality rates continue to decline, and life expectancy at age 65 increases. And to note, beginning in 2042, net immigration more than accounts for all population growth. Put another way, that without immigration after that year, the population would shrink. And just to note a comparison with projections the Census Bureau released last week, our total population numbers over the next 30 years are similar to those in the Census Bureau's high immigration scenario. Third, our estimates of net immigration for 2022 through 2026 are greater than we estimated last year. In 2024, for example, net immigration is larger than we projected last year by 2.1 million people, primarily because net immigration of foreign-born people without legal status is larger in our projections. In our projections, after 2024, the amount of net immigration largely returns to its historical average by about 2027. And just to highlight one factor that's led us to make this change in our projections this year, we know that in 2023, officials of U.S. Customs and Border Protection have encountered more people attempting to enter the country at the southwest border than in previous years. And they're releasing more of those people into the United States with humanitarian parole or with a notice to appear before an immigration judge. Fourth, our projections are highly uncertain. Rates of fertility, mortality, and net immigration could all be higher or lower than we're projecting. Our estimates of net immigration of foreign-born people without legal status are particularly uncertain. Thank you for the opportunity to talk about the role of population in our budget and economic projections, the growth in our total population, the key role of immigration in those projections, and the uncertainties involved. I would be happy to answer your questions.
Thank you, Doctor. Dr. Scott.
Chairman Heinrich, Vice Chairman Schweikert, and members of the committee, thank you for the privilege of appearing today. Pew is a nonprofit, nonpartisan research organization that uses evidence-based solutions to address pressing public policy problems. In summary, the United States is aging both in terms of the absolute number of older persons and in terms of their number relative to the working age population. And these trends, combined with insufficient retirement savings, will have serious implications for both federal and state budgets. The nation's 65 and older population will increase by an estimated 50% from 2020 to 2040, going from 54 million to an estimated 81 million. This rate of growth is nearly 10 times as fast as the growth of the population under age 65. Population aging will not be uniform across all states. For example, Nevada's older population will increase by 102%, with over 1 million older residents by 2040. In contrast, West Virginia will see an 18% increase. The relationship between older and younger households will also shift. Working-age households form the core of the federal and state tax base, but they will not keep pace with the growing older population. In 2020, there were 37 older households for every 100 working-age households, but by 2040, there are projected to be 54 older households for every 100 working-age households, a 46% increase. Different forces affect population aging, and I will focus here on birth rates and life expectancy. After the end of the baby boom in the 1960s, women in the late 1970s on average gave birth to 2.2 children over their lifetimes. Women today are forecast to bear 1.4 to 1.9 children. These lower birth rates mean that younger generations will not offset a growing older population. Increasing life expectancy also adds to the growth of older households. In 1935, the year that Social Security was created, life expectancy at birth was 62 years. By 2021, life expectancy increased by 14 years to an average of 76. Those who reach the age of 65 have seen a similar trend. In 1960, average life expectancy at age 65 was 14 years. By 2021, a 65-year-old could expect on average to live another 18 years. These aging trends impact retirement readiness. Research shows that retirees are not saving enough, and according to Pew-sponsored research, in 2040, households will fall short of recommended levels of retirement income by an average of $7,050 a year. Insufficient retirement income will reduce the quality of life for many retired households, but it will also affect government budgets. A lack of savings increases the likelihood that a household will need social assistance. Insufficient savings are expected to cost means-tested federal programs for older Americans a cumulative $990 billion over the 20-year period from 2021 through 2040. Insufficient savings will also cost state budgets. My written testimony provides a state-by-state breakdown of these costs over this 20-year period, but the aggregate cost of insufficient savings for the states is an estimated $334 billion. Additional work at older ages could help reduce these fiscal pressures, and labor force participation among older Americans is rising. But health issues associated with aging, such as an increased risk of disability and chronic health conditions, could limit work. Increased retirement savings can also reduce the fiscal cost of inadequate retirement incomes. Our analysis found that households saving an additional $140 a month could erase that $7,000 income shortfall. Recent initiatives could boost retirement savings, including pooled employer plans, a revised federal savers tax credit, and state savings programs for workers without retirement benefits. It's too early, however, to tell the extent to which these initiatives would significantly reduce these fiscal impacts. In conclusion, the aging population in the United States is growing, as is the ratio of older households to working-age households. These factors put pressure on programs designed to support older Americans, and those pressures will increase in the future. Policymakers would be wise to consider measures that encourage savings to lessen future demands on state and federal programs. I'd be pleased to answer your questions. Thank you.
A heartfelt thank you to Chairman Heinrich, Vice Chairman Schweikert, and members of this committee for inviting me to testify at today's hearing. I'm honored to appear before you to discuss topics I've studied throughout my career in public service and academia, in particular the intersection between an aging population and long-standing fiscal imbalances. Over the next few decades, the United States will be forced to address the fiscal challenges of an aging population. Our nation is in the midst of a rapid demographic transition where the share of Americans aged 65 and older increases by roughly 0.4 percentage points per year between 2012 and 2030, over which time their population share will increase from 13% to 20%, with a slower rate of aging both before and after this quarter-century period. In the absence of corrective action, the spending increases required by an aging population pose a threat to our nation's long-term fiscal health. Mandatory spending currently makes up about 70% of all non-interest spending, and major entitlement programs, Social Security, Medicare, and Medicaid, comprise 72% of all mandatory spending. The current demographic shift will put increasing pressure on these entitlements. All three are projected to reach all-time highs of spending as a percent of GDP in the next 20 years. Stagnant rates of revenue growth, with tax revenues as a share of GDP that are lower than many competitor nations, have played an outsized role in driving persistent imbalances. The Tax Cuts and Jobs Act of 2017, projected to increase deficits by roughly $1.8 trillion over 10 years, has exacerbated the insufficient nature of the tax code. This ongoing demographic transition has contributed to a sobering and perhaps even dire fiscal outlook. The Congressional Budget Office's long-term budget outlook projects that the national debt will reach 181% of GDP by 2053, far above recent historical experience, and multiple independent analyses paint an even more pessimistic picture. At some undetermined point, persistent and rising fiscal imbalances will demand policy action. I will conclude by listing these in turn, but will first note potential approaches that should not be adopted because they are insufficient to address the magnitude of the shortfall, or because the negative economic consequences would prove too severe to warrant their adoption. These include cuts in non-defense discretionary spending, utilizing the debt limit as a tool for fiscal changes, and abandoning Keynesian stimulus in times of economic downturn. Rates on income or wages, reversing the steep reduction in the corporate tax rate enacted in 2017, eliminating major tax expenditures, provided sufficient funding to tax administrators to enforce the tax code, introducing a new tax base on consumption or carbon emissions, increasing rates of legal immigration, slowing or reversing inflation rates in healthcare, or gradually changing the age at which Social Security benefits can be claimed. Thank you again for the opportunity to testify. I look forward to your questions.
Yes, of course. Thank you so much for having me. The U.S. budget is not age neutral. How a person interacts with it, from the taxes they pay to the benefits they receive, changes over the course of their lifetime. This wouldn't matter much if the population were steady and all birth cohorts identically sized, but we know that that's not the case, and we are facing the drastic effects of a large generation getting older and a smaller one coming of age. Today, the youngest boomers are 59 years old, drawing our focus to their aging in retirement. For decades, however, the boomers' vast numbers in our workforce obscured weaknesses in our labor market. Rather than their size necessitating policy, as it does today, it obviated the need for it when they were young. Now that they are retiring, those weaknesses are laid bare. There are policies that can counter the demographic pull, simply fewer of them. The first step in expanding labor supply and increasing the number of people working is retention. There are tens of millions of Americans who, because of some incident or shock or hardship in their life, have had to leave their job and never come back, representing years of lost work, if not decades of lost income taxes. Among the more common reasons for leaving, having your job eliminated, you, your partner, parent, or child becoming acutely sick or disabled, being incarcerated, having children. Each circumstance presents distinct needs that are worthy of their own policy agenda. At the same time, however, policies to address any one of them will have broad spillover effects because the problem is essentially the same. Once you leave the labor market, it is very hard to come back. Retention policy aims to keep people from leaving, making it easier to return when they want to. The cornerstone of retention policy is paid leave. It's a program that acknowledges that workers may need to leave for a period of time, but through a partial wage replacement and job protection, keeps them anchored in the labor force. The U.S. needs paid medical leave and paid family leave. Among the most broadly beneficial bang for the buck retention policies is accommodation. Accommodation policy codifies into law the right to work part-time, the right to request flexible and remote work arrangements, and a minimum number of paid sick days. Last year, the U.S. had the highest labor force participation in history for workers with a disability, because primarily of new remote work options. A lesson for us that when workplace accommodations expand, it expands who gets to work in our labor market. Given today's theme, it is also worth noting that neither a social insurance leave program financed via a payroll tax nor an amendment to the Fair Labor Standards Act to guarantee accommodation would necessarily add to the deficit, but it would add workers to our economy. But there are also investments that are costly in the short run that you can no longer defer. A job search stipend for long-term out-of-the-labor force workers who are looking to get back in, a long-term unemployment retraining program for workers whose jobs has been eliminated because of technological change, like the potentially 2.4 million jobs that will be eliminated for our economy by the end of the decade due to generative AI, but of course, in U.S. fertility. Having children is a very personal decision, and yet Congress has a wide avenue for intervention to make it safer, easier, and cheaper to have kids. Childcare is a massive price tag for families, more than college tuition and mortgages in most states. It prevents women from staying in the workforce and families from having additional children. I'll end by noting that I would be remiss if I did not use this platform to ring the alarm bells that I have hoped that you have heard before, that U.S. maternal mortality is unacceptably high. It is 10 times higher in the U.S. than in peer countries and increased 78% over the past 3 years. Demographics are not fixed. Policy can make a difference.
Thank you, panel. I truly appreciate this. I'm going to ask Senator Heinrich to make the first few minutes of inquiry.
Thank you, Vice Chairman. I want to start and just go down the line with each of you and ask you whether you think that both reductions in spending and revenue are both going to be necessary for us to reduce the deficit to more manageable levels, or if you think we can get there with one side or the other alone. So just your thoughts on whether or not revenue is going to be necessary. And we'll start with Dr. Topolsky and just go down the line.
So let me start by saying that CBO does not make policy recommendations, although we're happy to work with you to estimate the costs of things. One could certainly fix the problem by cuts in revenue, by increases in revenue, by cuts in spending, or some combination of both. There's a large fiscal gap to fill,
Right.
but I will defer it to you all to come up with the policies that can do that.
Dr. Scott?
Yeah, and I would just say that Pew has not taken a position or even done much in the way of research on that. I mean, I would say as a recovering academic that have done a lot of work on tax policy and on fiscal issues, I mean, there's certainly a wide
Revenue increases and spending cuts.
Dr. Edwards?
I would agree. You're going to need to do a little bit of everything to get there. I would caution you from cutting off your nose to spite your face, and that we still have to make investments to grow the economy. Cost cutting isn't going to grow our way out of this.
Dr. Edwards, sort of shifting gears a little bit back to what you were talking about in terms of paid medical leave, paid family leave. Do we have data on places states, for example, that have implemented those policies and the impact through labor force participation that's had on their state budgets, for example?
Yes, it will vary based on the number of years the program has been in place and the generosity of the benefits, but the direction is very certain. When you have paid family leave and paid medical leave, you are able to retain workers and increase labor force participation.
Great. Dr. Harris, I want to go back to you with respect to, you made a mention of the role of tax expenditures as a tool. Can you just elaborate a little bit more on that?
Sure, we have a massive tax expenditure budget. Tax expenditures, as you know, Senator, are effectively tax provisions designed to achieve some economic or social goal. I think some of them are well justified by economic research, others are less so. So, for example, one tax expenditure which I would be in favor of rolling back or repealing as a way of righting our long-term fiscal imbalance would be the step-up in basis at death for capital gains, with longer than they would otherwise in order to avoid paying the taxes. So that's one example of a tax expenditure that I think should be on the table.
Great, thank you. Childcare is incredibly expensive for the average family, and far too few workers have access to paid leave.
Worth it for a woman to work or possibly to have another kid. If it's larger than your mortgage, you wouldn't necessarily buy an extra house every year. That has massive effects on parents' behavior. The notion of labor force retention policy like paid family leave is just to make sure that, people will make decisions that are best for their family and best for themselves, but you're going to give them a period of time to sit out the labor force so that they don't have to make the decision basically under duress. And that's what you're giving them, is time and space to make a decision for their family and not basically forcing them out the door.
Vice Chairman,
So while you're distracted, I'll say it's probably also not the best that we cut family income by not having paid family leave right when a child is born.
I'm sorry, say that one more time, Dr. Edwards.
I said while you're distracted. It is also not advisable policy to cut family income right as a child is born.
We're actually doing a weird juggling because we're also running a Ways and Means hearing right below us. And Ms. Moore, I was going to let you go next, so you had some optionality of where you wanted to be. Yeah, it's a little button right in the base of the microphone.
Well, thank you so very, very much. This is an extremely important hearing, and I just want to thank the co-chairs for really putting this on the agenda. Dr. Edwards, I was particularly interested in your testimony. You started out talking about the U.S. Budget is not age neutral. So that brings in everything from Social Security and Medicare down to child care, and as you pointed out, childbirth. Immigration policy, it just brings in a lot of things. You noted in your remarks that, women are not having children. The replacement rate, all of you kind of have agreed to that, is not what it ought to be. But I think the debts, and also increasing the payments into FICA. Right now, we've got $500 billion a year that immigrants pay in just local sales tax and so on. would all of you, Dr. Edwards first, would sort of agree that immigration policy is important?
There is very little economic gain to having so many people not able to participate fully in our economy.
Dr. Harris?
Yes, I agree that immigration reform can be a big part of a pro-growth agenda.
Dr. Scott?
Well, certainly immigration reform could affect the number of workers in this country. Absolutely.
Right, and I think those data, we've seen CBC reports that have really demonstrated to us that just depending on cost versus expenses, we could see over a course of 10 years, maybe $1 trillion added to stuff like FICA sort of help us out of our conundrum with Social Security. I wanted to get a little bit more into your testimony, Dr. Edwards. You talked about, age, the budget not being neutral on age. You talked about the importance of not only women, for example, and you answered with the Senator Heinrich's questions, having access to child care, because those people who are kind of in the middle class either are not poor enough to get subsidies, but not wealthy enough to afford the market failure that child care is, and that, of course, that has an impact on women's workforce participation. But you also talk about the importance of having a healthy workforce. So expenditures on health care, I'm just wondering how many of you all think that having a healthy workforce and providing that benefit would increase workforce participation?
We can do within our economy to encourage people to have children, not necessarily forcing their hand, but maybe removing some barriers that make it harder for them to make the choices they like. What has never changed in the past 5 decades is the number of kids people say they want to have. Our fertility is unmet fertility intentions, not a change in fertility intentions. People are not having the kids they want.
That's exactly right. And the child tax credit. We need to stop looking at it as an expense, but an investment like you were talking about. Do you think, we didn't see any change in workforce participation when we provided that child tax credit. Do you agree that that child tax credit would enable us to put more workers into people to participate?
We only had the child tax credit to low-income families for 6 months. It still flows to wealthier and high-income households the way that it always did. But we didn't see any market effects on labor force participation for the 6 months we had of
You
advance.
didn't see people dropping out, in other words.
You didn't see people dropping out, but I would say that it's not on the same order of magnitude of child care. A child tax credit of $1,000 is not even an eighth of the way to paying for 1 year of child care for one kid. So whatever effect it has on family, it's likely going to be eaten up by basic necessities like food. If you have a child tax credit, the biggest effect will probably be on food insecurity.
Well, let's feed the babies. I got a cute video of my 5-month-old great-grandbaby eating, if anybody wants to see it. I mean, it really does inspire us. Thank you, and I yield back.
All right, we look forward to the videos, and you remember how terrified some of our Ways and Means. I have a 15-month-old, and he was sitting on my lap 2 weeks ago as we were holding a committee hearing.
Oh, he seemed to be clinging to you pretty good.
No, it's a joy. Okay, I'm going to just pick, in the juggling, I'm going to actually ask a few questions. We're going to run back down to Ways and Means. My senator friend here promised he won't let the fact that only my friends on this side are here run off the rails. Do this hearing is we're trying to get our heads around what's the reality of the numbers. I saw a number during the pandemic, I believe it's come back, that fertility rates had fallen, down all the way down to 1.62. But what I'm going to start from one end and work over. First, help me understand. Let's not do policy right now. What is the scale of the imbalance? If you and I were sitting in this room 10, 20 years from now, what does America look like? What is our over 65 population compared to our prime age working population look like? I'm trying to get an honest understanding of the resources. And I've been given a couple numbers in all of your opening testimonies, but I want to just start on one end. And basically, what does our world look like 10 and 20 years from now? Doctor?
So looking today, there are, and I'm I'm reading off a chart that has no numbers on it, so forgive me if my numbers aren't precise. There are about 3.5 people between the ages of 20 and 64 per person over the age of 65. Within 30 years, that number falls fairly dramatically to less than 3. So that's the sort of your pool of people available to work and available to support the elderly population.
Dr. Scott, how would you reference it? How fast are we aging?
Well, we're aging quite a bit faster. I would just second a lot of what you just heard, but one thing I would maybe note is that the growth of the oldest old of our population, those that are 75 and older and 85 and older, is rapidly growing. I think in the testimony we say that both those cohorts will double in size by the year 2040, and the majority of the older population in 2040 is projected to be 75 or older. So you're going to have not just a lot of older people, but people are living longer.
Remind you that our fertility is not fixed. I mean, we are coming out of a 15-year decline fertility, but when you ask what it looks like in 20 years, that is up to you. I mean, we could have another baby boom with certain policies and.
Actually, to that question, and Dr. Edwards, I'm sorry to interrupt, tell me the country in the industrialized world that's been facing this for 30 years that has had successful policy that has changed long-run fertility rates.
So France's fertility is above replacement. It's about historically at 2.1.
And where did they go to their lowest?
I'm not sure.
See, my understanding is France has stayed actually quite stable, and substantially that's from their immigrant population.
That is my understanding as well. I don't know their exact numbers. I do know they have childcare.
Yeah, Hungary, is it true on the third or fourth child, they literally buy you a home, and it has barely moved their fertility rates?
So I'm not sure about Hungary. I do know that Germany's fertility rates had fallen for a period of time, and it is starting to increase. I'm not sure how it fared in the aftermath of the pandemic.
Yeah, you have to make an adjustment for those months. And look, I have a data set in my binder that basically talks about a couple things. In the 1970s, for every, I think it was $5 for people under 20, there was $1 spent on seniors. Today, that's functionally reversed, and will continue to reverse. Impact, would any of you be able to speak to the fact that there was a number here, I think it was saying, was it 2042, 84 million, 65 and up? Can anyone help me with that? Okay, all right. So if we're here 20 years from now, how much of the U.S. budget basically is for earned benefits, both the healthcare costs and Social Security, because we have, 9 years, and we have to start to deal with the fact that the Social Security Trust Fund is gone. Functioning the next decade to see doubling of homeless baby boomers. Am I being a bit apocalyptic? Please, someone correct the numbers that I'm being given. Dr. Scott.
I won't correct your numbers. I would just note that, there are a lot of pressures that are going on. I talked about the growth of the oldest old, and that has implications for a lot of the means-tested programs that we studied at Pew. We certainly know that the number of people with Alzheimer's is going to grow by a very large percentage. So I think, those are the worst-case scenarios. It's not necessarily apocalyptic to say that, but it's not necessarily what could happen too. But I think that we see these trends and are very concerned about the impact on both federal and state budgets going forward.
And I will return, Mr. Chairman. The CBO puts out a number, and it makes it very, very clear from today through the next 30 years, every dime of future borrowing is functionally Medicare, interest, and if we choose to backfill Social Security in 9 years when the trust fund's gone. The rest of the budget is substantially flattered and balanced. And I think actually some here is first to have a commonality of how tough the demographic numbers are, and the fact that the revenues, it's spending, it's actually demographics. And with that, I shall return.
We'll see you soon. Senator Klobuchar.
Thank you very much, Mr. Chair, and thank you to our witnesses for your testimony. Dr. Harris, your testimony references, when you look at the need for, as we look at the seniors and the changing demographics, the need for people to take care of seniors. And pretty soon there's going to be no one to take care of grandma in the middle of Nebraska at our assisted livings, and we're going to have issues, and already do, in rural hospitals and the like. So that bill, I remember it because Grover Norquist was one of my witnesses at this very committee, because he supported the bill because it reduced the debt, and it showed back then that the bill would have increased GDP by 3.3% and cut the deficit by about $900 billion over 2 decades. I will admit these are 2013 figures, but I think we could imagine the same thing now. Could you talk about how similar legislation could have the same effect now?
So economists don't agree on a lot, but we do agree on the benefits of immigration reform. And survey after survey of economists support that statement. And from the perspective of caregiving, I mean, there's almost too many benefits of immigration to list. We see increases in patents. We see decreases in prices. As we start to be selective about what types of workers we let in to address certain workforce gaps, we start to see less type specific labor markets. So for example, we have gaps in caregiving centers, as you referenced. The caregiving crisis, I do consider it a crisis, has 2 primary effects as older Americans are subject to a lack of caregivers. The first is higher prices for caregiving. As you have a shortage in those caregivers, they can demand much higher prices. The second is that unpaid caregivers increasingly bear the burden, and we're basically talking about middle-aged women bearing this burden right at their peak earning years. It has enormous consequences for the labor market in general and for these families in particular.
Okay. Can you talk about the positive effect that immigration reform could also have on Medicare and Social Security solvency?
Yeah, so when we're talking about these major programs, as we have younger people coming in their workforce, in their working lives, and they're paying into these programs, we're talking.
In your testimony, you talk about costs for healthcare programs and rising costs. One of the things that we've been working on a bipartisan basis out of the Judiciary Committee is how to reduce prescription drug costs. We already have the negotiation going on with Medicare. It's a bill that I led for many, many years, and we have the first 10 drugs on the being negotiated now. I will note that those 10 drugs, which includes Januvia and Jardiance and Eliquis, and I like to say these names because I memorize them. Those 10 drugs, 9 million seniors last year, they shelled out $3.4 billion in out-of-pocket on those 10 drugs alone. And you can imagine what we could do with more negotiations. But there's also patent issues with, generics being kept off the market, and all kinds of things with the way the pharma companies are playing with patents. Could you talk about how that could help with reducing costs for healthcare spending?
So on that answer, I'm going to have to say I would be happy to talk to you about that when I have the right people in the room. I'm not a healthcare expert, and so I wouldn't want to speak on that issue.
Does anyone want to add to that as we look at costs? Okay. It's just, I think as we look at this deficit issue, it's just one of the driving forces. So keep it in mind as you keep working on these issues. Really appreciate your work. Thank you.
Senator Welch.
Thank you very much. We're talking about the demographic challenges, and it's interesting. I just want to start with you, Dr. Edwards, about the factors that you attribute the reduction in fertility, and it sounds like it's voluntary.
Decline in fertility is unmet fertility intentions of people not having the kids they want. For millennials, including elder millennials like myself, part of it was a delay, that the fertility that we are currently seeing as a decline can still be regained because fertility is falling for women under 30 but rising for women over 30, which is why something like infertility coverage as part of health insurance would be helpful in this kind of notion to drive up fertility. But the reason why, in surveys, parents say it's expensive. every part of having a kid is expensive. Childcare is expensive. They don't have paid leave. It costs $2,600 to deliver a kid out of pocket if you have a vaginal delivery. If you have a C-section, it could be $32,000. There's a lot of money
Right.
for that's taxing a kid being brought into the world. That's the opposite of what you want to do if you want children.
So in France, where they have a stable fertility rate and above replacement rate, they have paid family leave. They have, you don't pay for your health care, so you don't have that expense. You have child care.
It's not that everything is free there, but they do have support around young children. That's certain hallmarks of we lack in the United States. But there is also a room for just kind of basic economic malaise to hit people's childbearing intentions. You know, you don't own a home, you're not married yet, you don't earn as much as you want.
Public policy issues there. I mean, a lot of folks here have been very strong proponents of having public policies that are pro-family. And I think the way a lot of us define pro-family is you can afford child care, you can afford health care, you can have confidence that if somebody's sick, a child, a partner, you'll be able to take some time off. And I guess the obvious question is, in your view and in the basis of your studies, would those types of policies likely influence the fertility rate?
Yes, because you can't make people have children, but you can make it easy.
That's a big deal. If we had more legal pathways and could have more immigrants coming in.
Yes, so one of the benefits of legal immigration is we can tailor the system to exactly the needs of our workforce. We have that benefit being the United States of America. I've heard economists refer to immigration as the economic superfood, which I think is an appropriate adjective for what we could do with immigration, economic growth.
All right, and then, you know, the other thing that Senator Klobuchar was talking about were some of these costs. It's unbelievable how much health care costs in this country, and it doesn't matter whether you're on Medicaid, Medicare, private employer-sponsored health care, or you're paying yourself. We pay the most and get the least. It's the same is true for cable and internet. I mean, there's a lot of expenses in this country that everyday families have to bear that are brutally expensive. So I'll ask maybe Dr. Scott and then Dr. Topoleski, how much, where we have policies that try to essentially promote, I hate to say it, competition that would result in lowering cost for families, would that have an impact potentially on people's sense of confidence that they can have that other child that they would love to have in their life?
No, there we go. I mean, I would hesitate to give an answer just because we haven't really studied about the, which I think is a really interesting issue, how the costs of some of these services and goods might affect fertility decisions, but certainly, you know, we could certainly see that happening, those scenarios where, you know, lowering certain costs could have an effect on decisions, but that's something that's a little bit beyond my expertise, I think.
And my answer is going to be quite similar in that we haven't studied particular policies that would, and the effect they would have on fertility, but it is something that we're keeping an eye on because it is very.
Drivers of our deficit. Who is that group? Drivers of our deficit. Who is that group?
I'm sorry, you're asking who's the driver of the deficit?
The title of the hearing is Aging Americans and a Waning Workforce. Demographic drivers of our deficit. This title pinpoints one group of Americans as the drivers of our deficit. Which group?
The title suggests older Americans are the drivers of the deficit.
Would you agree with that?
No, in my written testimony, I think that a driver of the deficit is an imbalance between revenues and expenditures.
Okay, so I think what concerns me about this hearing title is it seems to suggest that the deficit all comes down to grandma. And that, in fact, as you just said, the national deficit is calculated. Deficit is spending minus taxes. So if Republicans are trying to say today that seniors, that older Americans, aging Americans, grandma, is the driver of our deficit, seniors must be, and deficit comes from spending less taxes, then seniors must have been responsible for making our nation's spending and tax decisions. Is that right? Did seniors write our tax code?
Not to my knowledge.
Did seniors write our government spending bills?
No.
Who does those things, Dr. Harris?
Congress.
Congress. For 88 years, Congress has promised seniors Social Security. For 58 years, Congress has promised seniors Medicare. And during that time, Congress, not our seniors, should have found ways to keep promises without taking on too much debt. Dr. Harris, isn't it unfair to blame aging Americans as drivers of our deficit when it's really Congress's job to make these budgeting decisions?
I would say it's unfair to blame any Americans for this deficit. I would blame effectively those who made the decisions.
Okay, so I'm curious, given that Republicans are, the provisions of the Republicans' tax package increase or, add to or pay down our national debt?
It undoubtedly added to our national debt.
Republican math here, it added to our national debt. Let me show everybody how much. Wait, hang on. It's a two whiteboard situation. Can you read that number for everybody?
That's 1.8 trillion.
1.8 trillion. Couldn't even fit it all on one whiteboard. So this is how much they added to the deficit, even as the premise of this hearing is that the deficit is a real problem and that Republicans believe it's a real problem. So if they didn't solve our deficits through the tax code, through that tax piece, they surely took action to fully pay for Social Security and Medicare so that we don't drive up the deficit that way. Dr. Harris, do you know how many Republicans co-sponsor the Social Security 2100 Act, which would make Social Security solvent for years to come?
I don't know. I'm guessing 0.
0. It's a really small number. Don't even need a whiteboard. Can do this one with my hand. So Republican math in terms of the budget, which is made by Congress, not made by seniors, by older Americans, means increasing our deficit by $1.8 trillion and doing 0 to reduce the effect of the debt by Social Security and Medicare and adjusting those policies to be able to be better funded. So I don't think we should buy into this hearing's premise. The demographic changes in our country are really interesting. As a single mom, I absolutely hear Dr. Edwards on the cost of raising a child. I think the points you make about immigration are all lovely, but I don't think we should lose sight of the fact that we as Congress have
in 30 months. So we can both play the whiteboard, and it turns out math will in 30 months. So we can both play the whiteboard, and it turns out math will always win. Mr. Trump.
Thank you, Mr. Chairman. Moving. Thank you, Mr. Chairman and staff, for gathering us here today. Look at these demographic trends. As our nation faces a aging population, lower labor force participation, rising mortality, and declining fertility, the responsibility to act really falls on us. We've got to figure this out. So we have to recognize the complexity of these trends and pass legislation. It's going to be things that we do here in this group to help deal with the magnitude of this issue. And the Census Bureau survey found that 5 million people miss work every week. 5 million every week, simply because they can't get care for their children. No daycare. If we invest in adequate health care, mental health services, substance use disorder, recovery programs, subsidized child care even, heaven forbid, and early childhood education, we can shift those trends in a better direction and get more labor participation. So my first question for Dr. Edwards, in your testimony you highlight the reasons why these individuals leave the workforce. One of the reasons was having a child and the rising cost of child care. I'm a strong proponent of the child tax credit, universal pre-K, affordable child care. Talk about these policies and others you would support that would help us on the labor market for working age women to fully participate.
Thank you so much for the question. I mean, I think anyone who has ever met a toddler could tell you why it's so hard to work and have children. Part of that is having a safe and affordable place to put your kid. Right now, we know that the highest quality early childhood is really serviced in a U, where the very richest households are able to get high quality care, and then a select share of the poorest households that qualify. Make it easier for women to work, but the other part is making the workplace easier. Countries that have had very high success with high women's labor force participation have the right to request part-time work. They have the right to request flexible and remote work arrangements, something that would also benefit people who are experiencing kind of acute or temporary health or even disability in their life. I mean, we do want to make the workforce healthier, but we also want to make work more amenable for people who can't be healthy. And that's a two-way street that starts not just what we invest, but with the kind of the rules of the game we set out for American workers.
But good. Foreign-born people account for more than 18% of the labor force, yet they're half of the growth of the labor force. Pretty dramatic difference there. Before the pandemic, in your testimony, Dr. Harris, you focused on the benefits of immigration. I'm a huge immigration proponent of the beautiful diversity it gives us, diversity of ideas that give us better solutions time and time again, the creation of jobs. So talk a minute about, elaborate how this increase in immigration can really impact our labor force and drive the deficit down.
So immigration has a wide array of economic benefits. One, I think, is, as you alluded to, was innovation. We see the number of patents per capita rise substantially and significantly when we let more legal immigrants come to the country, As terms of the finance outlook of younger workers come into the economy, and actually prices go down. And we've been dealing with inflation as a country for the past 3 or 4 years. And so if we're, as an anti-inflation program, immigration can help solve some of those problems as well.
Does anybody in the panel quickly have a sense of how many immigrants we've let in each of the last 5 years through lawful immigration? Change and allow more folks in as our population is going up to 330 million. What changes have we made in our policies to let more immigrants in legally each year?
We have not had comprehensive immigration reform. In 2013, we had S-744, which passed the Senate, I believe, with 69 votes. So there was obviously high consensus in the Senate, but we haven't had comprehensive immigration reform in quite some time.
You'd say it's past due time to figure out how to get more folks here, drive the economy, cut down the deficit, and reduce inflation.
Yes, I would.
Thank you. I yield back.
Thank you, Mr. Trone. Actually, you're hitting one of my favorite subject areas. Forgive me, but I'm going to actually, because there's a couple of things I'd like to chase down. I actually want to follow up on Mr. Trone's, and I'll start with Dr. Harris because this seems to be one of your areas of interest. Let's say you and I were about to do immigration reform, as we're trying to do as much population stability, because I am going to ask the other parts of the panel about the 75 and older. So I'm trying to, but doesn't, for productivity, for velocity, for tax receipts, doesn't have to be mostly a talent-based sort of model. Because there's a brilliant article that was in The Economist magazine a little while back that basically said the 70s, 80s, we all went at each other for hydrocarbons. Last decade, it was rare earths. With the next couple of decades, it's smart people. How far off am I?
I think it's an excellent question. I have had my thinking on this changed a bit by research. And so, for example, there are economists at the Brookings Institution who have recently come out with research that have said it's not just the high-skilled workers that can drive higher productivity, but some lower-skilled workers that have nodes to the rest of the economy. So, for example, truck drivers.
It's a future where longer haul is an autonomous truck, starting to find the mix, and then what do we have to supplement with higher talent populations? Dr. Tobolewski, I know CBO had worked up some data, and was it just 2 weeks ago, we got an update from Census. Do you remember what those numbers were for 75 years and up, particularly over the next 10 years, 20 years, and has there been an estimate of the stressors that will cause on resources for Medicare?
So I don't have the numbers of 75 and up at hand. We could certainly get those to you. We have that level of demographic detail, and that's available in the census projections as well, so we could send you a comparison of the two groups. But certainly an aging population, particularly as others on the panel have said, the oldest old, they are an expensive group.
Okay, and because there is a spot here where, and Dr. Edwards and Dr. Scott came close to this, and I want to start to get some of my heads around, because also at the same time, I'm looking at data that says we may be going into our 5th year where life expectancy, particularly for males, actually is falling. And we've done some work. It's a little harder to vet, so I have to, where we used to believe it was drugs is way up there, but it was actually obesity. Maybe one of the greatest difficulties within that population is Ms. Edwards at one point talked about some of our horrible maternal expectancies, and if you actually dive deep into the numbers, it's obesity in some of the populations that are having some really difficulty. And it took a long time to find some of those data sets. Dr. Scott, that's 75 and older, it's cost. At the same time, I'm being told life expectancies, particularly for males, is falling. What am I not understanding? Brothers and sisters who COVID changed mortality statistics. Recently, but we also have been trying to take a look at, even in some of our quartiles, and be brutally honest, morbid obesity and those things, and what that's doing in bending over life expectancies. Am I looking in the right places? Am I fixating on the noise?
I'd be happy to follow up, because I think I've seen some data that shows we do expect some increases in life expectancies amongst some of the older groups to catch up with some of the differentials we see between men and women, between Hispanics and whites, et cetera, et cetera. I'd have to follow up, but I mean, the fact that, I mean, I was just looking at the numbers that we projected on the 75 and older. We're going to move from 29 million people 75 and older in 2020 to 45 million by the year 2040. That's a 107% increase. So I think in general, we're seeing increases in life expectancy across the board. But I take your point, and I think it's an important one, that's not uniform across different groups in society. And so I'd be happy to follow up on some of those differentials in life expectancy.
Okay, and Ms. Edwards, and I'm not being mean here, because you've actually given some terrific stuff, but we did just sort of look up, World Bank actually has France's fertility at 1.8. So there's always some noise sometimes when we get data. But you had something you wanted to share?
Yes, as regards to maternal mortality, the spike over the last 3 years, a near doubling of maternal mortality in the U.S. was not matched by a near doubling of obesity. There are long run drivers that can make a risk factor, but this spike that we've seen is an opportunity to identify the problems.
Yes.
And hospital quality is a key part of that, not how the hospital serves everybody else, but how hospitals serve mothers in particular. There is room for policy here, and it's not just a mom's health when she walks in the door to.
Anyone else have something burning they wish to ask?
Thank you.
Okay. What?
I got something burning I'd like to ask.
No, Ms. Moore.
I mean, whoever gets to ask a burning question.
I said burning, not Bernie.
It's burning. Listen, I've heard a lot as a member of Congress about, balanced budgets and deficits and where we're at in deficit spending now. I just want maybe Dr. Harris for you to review, maybe in the last 5 years we've had surpluses 5 times in the last 50 years. And I keep thinking that whenever we give these huge tax cuts, seems like that's the time that we accumulate these big deficits, even though there's a promise that we're going to see, an increased spending, an increased GDP, we find ourselves in a deficit situation. It seems to me when Bill Clinton was in office, I recall that very vividly, there was a surplus that was left. Then we had Bush tax cuts. Then we had Obama who came in and, and there was a double down on the Bush tax cuts with all the wars in between. And now, under our previous president, we had some more tax cuts. Can you give me cuts and the occurrence of those tax cuts with deficits?
Sure. So in instances when we've had relatively strong fiscal positions, as you mentioned in the late 90s, it's either been driven by cuts in spending, increases in revenues, or strong economic growth, like we saw with the dot-com boost. And so that's just kind of the general. I mean, there's really three variables that go into our fiscal outlook.
What about the Bush tax cuts? You know, and then doubling down on them during Biden, Obama administration.
Yeah, so we had the 2001 and 2003 tax cuts, which had a variety of different elements, but some of those elements I consider to be scored very poorly in terms of generating additional economic growth were, for example, the estate tax cut that was put in place in 2001 and then continued through in the 2017 Tax Act, and then also dramatically lower tax rates on capital, I don't think necessarily had the economic boost that the proponents hoped.
Just wondering, you know, as we talk about deficit, just want some perspective. Thank you for that. And thank you, Mr. Co-Chair.
Thank you, Ms. Moore. Mr. Byer.
Oh, you're back.
Yeah, we're all excited. We were stalling for him. We knew he would make it.
Thank you for waiting. And thank you for the testimony. I didn't get to hear all of it, but I read all of it. I want to, and by the way, David and Senator, thank you so much for doing this hearing. It's incredibly relevant. And you see it every day, everywhere in our lives. And thank you for all the statistics. I saw a fascinating statistic the other day about average family size and how in the last 30 years, you had 18% of women would never have a baby, and that's now up to 36, 37%. Just the whole notion of zero children families, whereas the one-child family stayed roughly the same. But when you think about it in terms of the workforce, it gets pretty frightening. But I also, given this is the Joint Economic Committee, one of the things we worry about, of course, is the gap between the 21, 22% we're spending on the services that every American demands and the 15, 16%. We had the little surge after all the economic impact payments and the like, but 15, 60% of GDP and revenues. It'd be really interesting, Dr. Harris, to talk about how much of this goes back to the tax cuts. If I was being partisan, I'd say the Republican-led tax cuts, but the tax cuts, they go back.
I think that you're right to point out the tax code is so much more than just the 2017 Tax Act. Most of the tax code is not that single tax act. This is decisions made by Congress going back decades, if not longer. Ultimately, it's just a math problem. When we look forward 10 years, we have this structural deficit, which means that, according to the Congressional Budget Office, we have an average deficit of about 3% of GDP if you take out interest payments and if you take out the business cycle. So this is when CBO assumes we're back at full employment. We're just 3% off. We're just a math problem. We raised 3% of GDP too little to not continue to accumulate deficits. So I think that you're right to depoliticize it, though.
Yeah, we also look, I know very few Americans who think that they're overtaxed, or undertaxed, I should say. The one exception being the wealthiest among us, where, as we know, the people sitting here are all taxed 30, 35%, and yet the wealthiest, the 50 million plus, or I think the average is 8% of their income is taxed. Do you see ever the political appetite to go after where the money is in order to close that 3% gap?
I don't necessarily see the political appetite, but I will say I'm a little confused by why we've seen the political nature of the IRS funding. Because in my view, it's not just about tax burdens, it's also about competitiveness. And so we look at small businesses or even large partnerships who sometimes have very large tax gaps, who have just enormous tax liabilities they don't pay. I see this as a competitiveness issue. And if you came to me with a policy, you said, look, we want to go ahead and distribute trillions of dollars in the tax gap to various businesses based on their willingness to pay taxes, I would say you're crazy. But in effect, that's what's happening, where we're not enforcing the tax code. It's costing taxpayers trillions of dollars every 10 years. And ultimately, it's a competitiveness.
Cost the economy $4 billion. And we don't really have any data on retirement readiness, on retirement income for a lot of those folks, or just My high school classmates tell me that I'm the last person in the class not to retire at age 73. And yet, we know that we're going to need people as old as David and me. They're young. To be in the, well, you got a little kid, so to be in the workforce. How do we address older workers?
You know, the nice thing about labor supply policy is that it's actually really hard to isolate. So if you were to pursue things like accommodation policy, the right to work part-time, you know, the right to request flexible arrangements, that you wouldn't be able to prevent older workers from taking advantage of that. You know, most of us have this notion of retirement, especially among couples, that two people come to a decision, today's the day I stop work, and they just stop. But that's not what retirement looks like in America today. Most people phase out of work. They move to part-time if they can. They work a little bit when they want to. And a lot of people backtrack where they stop work and they're like, oh, I'm ungodly bored, I'm going back. And they go back to work. And that, you know, recognizing that retirement is not a decision, but a process, certainly by our labor market and our employers and our Social Security system, would help us carve basically the most efficient policy to let people work how long they wanted to work and not put barriers in place in front of them.
You know, for example, the State Department, you're out at age 65, despite the fact that's an age when most people are coming into their full diplomatic skills. My grandmother was thrown out of USAID at age 82, kicking and screaming. But they'd already given her a pass again and again. What can we do to encourage people to stay in the labor market longer, to stay actively working, besides making it so they can't afford to retire?
You know, I think you have to meet people where they are. There are lots of instances in people's life where work justifies for people, not just the types of jobs we have, but the types of ways that people consume those jobs.
Yeah, I was, Chairman, if I could ask one more question too, or just a comment. Yes, I had the pleasure of living in Switzerland for 4 years, where the part-time people, it took us a while to adjust to it. They were 30% or 50% or 70%. And if somebody like Gwen had a 50% job, that meant that she got 50% of the normal income, 50% of the benefits, 50% of the vacation pay. And it wasn't like here, where if you're part-time, you don't get anything. And it worked, and then people could actually take a 30% job or a 60% job and really integrate it with the rest of their lives. And the whole economy had adjusted to that, and it was something we could learn from. With that, Mr. Chairman, I yield
Thank you,
back.
Don. Jody, welcome.
Chairman, thank you for holding this hearing. You know, this topic is near and dear to my heart as budget chairman, but before that, I was thinking, what could possibly be more important, more destructive to our prosperity, our future, economic strength, national security than national insolvency, undermining the currency, bankrupting the country. There are a lot of ways to say it. It just, nobody believes that I've talked to who's serious on either side of the political spectrum and ideological spectrum that the current deficit spending and debt is sustainable. They can't tell you exactly when this thing really goes off the rails, but I think the vicious cycle of deficit spending increases and the interest, they want to solve the problem too. I think it's a spending problem, but if they will work with me by including revenue, I think that's fair. Because if I don't, then we will never have this conversation and we'll never address it, and we will bankrupt the country, and then seniors won't have safety nets that they rely on. Our soldiers and sailors won't have the tools to be safe and successful. And China, more than likely, or someone else becomes, in this new world order, the global superpower. And that's all unacceptable to me. So while I have no interest in raising taxes, and while every analysis on my end suggests It's the spending that's absolutely running away from us, and it's the expansion of the federal government's role beyond what I believe was ever intended. And the fact that when you can deficit spend, that is, if you can borrow or tax the next generation and not actually take any money out of people's wallets today, or cut program. I always use the farm bill because I'm from ag country. Because you don't have to do that and you can keep borrowing, and you're the world currency, that's the recipe to end the republic as we know it, not from existential threats, but from our inability to. Now, let me get to the point. I know that's not, I'm sorry. So I believe everyone's motivated here in their own way to address this. We need to protect, strengthen, and save certain programs. I would say Social Security and abuse. So taxpayers ought to be protected. Program integrity ought to be at the highest standards. But here's my question. If your unfunded liability is $120 trillion, according to CBO, 30 years out. And yeah, and it's hard to keep up with it. It keeps climbing. If it's $120 trillion and 99% of that in the 30-year outlay on deficit spending, the cumulative debt, $120 trillion, is two programs, Medicare and Social Security, and those are important and we need to make them sustainable. What's the solution? Nobody wants to talk about it. So I'll ask you all, you're the experts. We're talking about a debt commission, having a bipartisan venue to dial down and depoliticize those issues so we can help make them work better and sustainable for the next generation of seniors, not just for the ones today. What do we do? What do we do? Do we just bury our heads in the sand? I had an event, a budget committee hearing on just that, not on Social Security, by the way, and its viability and sustainability, just on the debt commission. And I had some guy that may be in here today that just followed me with his camera all the way to the floor of the House saying, tell the American people why you want to take away their Social Security. So we're just going to wait till the whole thing collapses? By the way, then you got austerity. You got everything you don't want, from the tax side to the cut side. And by the way, you don't get a choice. It's going to happen. So what do we do? I'll start with Dr. Edwards and maybe go left, and then I'll be done. And I will beg of everyone to be fairly efficient. Yeah, I know I've got to. Did I go way over? I'm sorry.
The Social Security's 75-year actuarial shortfall emerged before I entered kindergarten, and they've been around and growing since. And every year that we wait to fix them is a year that they get more and more expensive, and the republic does seem apocalyptically doomed. But they don't have to be. What I would stress to you is that whatever you need to do, you do it now. You need to address this now for the sake of Americans who don't want to wait until the night before the funding expires in 2033 to see what's going to happen. Because uncertainty on top of everything else is not fair to give Americans Social Security cost out actuarial policies and exactly how much they can fix the problem. You go shopping, you pick what you can agree on, and we don't have to have this discussion every year.
Maybe one more witness. That was great. I agree. Dr. Harris.
I will say I can give you my preferred approach to Social Security, but I think more importantly, I've been doing this for 25 years and working in policy. I've found the tone of this committee to be admirable, if not inspirational. You all are presenting a very collaborative front, which is what is required for any type of Social Security reform. Social Security cannot be fixed through reconciliation. It requires 60 votes in the Senate. So I can give you my prescription, but I think most importantly it requires members of Congress like this committee who are willing to work with each other.
Well, I want to compliment the chairman that we have to have political courage at the end of the day, and we've got to care more about the country's future than our own political future. I'm not saying I'm always William Wallace of Braveheart, but I certainly have to muster as much of that as we can if we're going to save this country. God bless America. Go West Texas, and I yield back.
Thank you, Mr. Arrington. And to Mr. Heinrich, thank you once again, your kindness, and I want to say thank you both to the Republican and Democrat staffs. We are sort of demonstrating, you know, we often see the world being sent to you. If you'd be kind enough within a couple of weeks to respond to those, and to members of the committees, if you have other extraneous materials you'd like to make part of the record, please provide that within about the next 14 days. And with that, this hearing is over.